Hello, good morning, and welcome to our panel session on digital healthcare presented by Axios International. Now, my name is Audrey Raj. I am a broadcast journalist, producer, and presenter at BFM 89.9, and I am really so happy to be here in person with you and to be your moderator for this session. Over the next about 40 minutes or so, we're going to be talking about digital healthcare, and more specifically, the role of digital healthcare in providing holistic support solutions beyond the hospital setting. So, digital healthcare. It's apparently going to be a game changer. The question is, how? Now, the pandemic, of course, accelerated the adoption of all things technology, and it also showed us just how much we need things like telemedicine and remote health-related services. While we were trying to flatten the curve, digital healthcare became the ideal solution for limiting patient displacement to hospitals and allocating hospital capacity to more urgent cases while curbing the spread of the virus. So basically, the last 2 years have really set the stage nicely for digital healthcare, especially here in Malaysia. The nation's healthcare sector is expected to grow to $30 billion by the year 2027. That's less than 5 years, with potential in areas of medical tourism, the manufacturing of medical devices, pharmaceuticals, and clinical research. And this is an attractive market for tech companies, including health tech in Southeast Asia, thanks to our economic growth and the digital technology infrastructure that we have here. We also, Malaysia, also have high mobile phone and social media penetration because, you know, we're cool like that, right? Yeah, so I joke, but if we really do this right, as in if we leverage on digital tech successfully, it could lead to great benefits, not just for healthcare stakeholders, but also patients. Think about shorter lead times for treatment, higher treatment adherence, and improved access to healthcare in general. So it's just gonna be beautiful for everyone. I'm excited, but I'll let the experts do the heavy lifting to break down exactly how digital healthcare will provide holistic support solutions beyond the hospital setting and give us a glimpse into what the future of healthcare will be like. So without further ado, I think I've spoken for long enough. Let's introduce our panelists. First up, we have Rochelle Jayasundra, Senior Director of Global Consulting at Axios International. Now, Rochelle oversees the market access strategy, consulting practice, and client relationship management, addressing client needs across multiple therapeutic areas in Africa, Asia, Latin America, Middle East, and Europe. She's really, really busy all the time. In addition to overseeing business development and project management for all Axios' healthcare access programs in the same markets. Welcome, Rochelle.
Thank you, Audrey, and thank you everyone for being here.
Next up, we have Rafael Ita, the head of digital at Axios International. Rafael leads technical and functional teams who take Axios and all its partners through digital transformation. His current responsibilities and focus includes designing, developing, and implementing digital health initiatives for Axios and its clients based in the UAE. And I have so many questions for Rafael. So welcome, Rafael.
Thank you, and thank you for having us.
And last but not least, our kawan here from Malaysia, we have Edmund Lim, founder of We Care Journey. Edmund's son Brandon was diagnosed with spinal muscular atrophy, or SMA, and in trying to help his son, Edmund realized that there is a lot that needs to be done to satisfy the unmet needs of the SMA and rare diseases community right here in Malaysia. So with his wife Suki, they founded and they run We Care Journey to care for families with SMA and other rare diseases. Nice to see you again, Edmund.
Hi, thanks, Audrey.
All right, guys, thank you so much for taking the time to do this. Thank you so much for joining us, everyone. Before we jump into our discussion, a quick reminder that you too will be able to shoot your questions to our panelists, but you're just going to have to wait till I get through my list first. Is that cool? Okay, let's go. Right, so Rochelle, just to kick things off, Axios has emphasized the importance of out-of-hospital care for many, many years, which has been highlighted by the ongoing pandemic or endemic. How do we move forward from here as the country adapts to endemicity?
Thanks, Audrey. So I think it's first important to define what does out-of-hospital care mean and why did we start to look at this? So throughout the years and through our programs in the different countries, we interact very closely with the patients and follow them along the patient journey and realize that there are multiple gaps when it comes to delivery of health care that continue when they leave the hospital setting, right? So having that patient-physician relationship is important, but then what happens to these patients the moment they're outside of that office? So that's why we started to focus on that. And I think the pandemic has acted as a catalyst to really highlight this gap, but also a catalyst to drive digital adoption. So this is something that I know we will be discussing at length today, but it's something that we also leveraged as an opportunity to further push the message of let's focus on this out-of-hospital care and not just abandon the patients to whatever happens in the clinical setting. Now, when it comes to the pandemic, which is now gradually moving to be an endemic, what I think is critical is to not forget those lessons learned. There's been multiple apps that have come out to help tracking. There have been multiple initiatives to support teleconsultations, for instance. So we should not go back to the old way completely, I would say, rather learn from those lessons and take the next step forward.
Definitely. Now, Raphael, why is digital healthcare so crucial in Malaysia and the rest of the world today? How does it improve the patient journey and essentially lead to better treatment outcomes?
Thank you. I think it's crucial in Malaysia and in the rest of the world because of this out of the hospital setting. It creates a connected care between HCPs, nurses, pharmacists, and the patient, so that we know what happens to the patient when they are in the hospital and when they're not. It also allows for a flow of information so that, for example, the physician can know what happened if they went to the patient went to the pharmacy. That kind of information is crucial for them, right? In order to make personalized treatment. That would be the first advantage and why it's crucial. Secondly, it creates a more efficient management of the disease. The current one, ongoing illnesses, but also with the collection of data and that flow of information that I was talking about, we will be able eventually to predict those illnesses that could come up. And that's also crucial with the rise of technology such as artificial intelligence, 5G, I think we'll talk about it a little bit later. Machine learning, this is how we're going to be able to leverage the technology to predict what's going to happen. And finally, on the more admin operation side, it streamlines the operations. It kind of removes the room for human error because we're all human and we all make mistakes, and that removes that to a certain extent. So that creates a better personalized treatment for the patient, which results eventually in better outcomes.
Right. Now, Edmund, based on your experience of working with rare disease patients, what are some of the barriers to treatment access and adherence that patients face? And do you think digital can help address these issues?
Rochelle talked about the pandemic. So with the pandemic, I think all of us felt at some point isolated at home, right? Because that's just what happened. But for rare disease patients, they have very chronic medical conditions which require a lot of visits to the hospital, right? And that consultation is really important to help them figure out, what's happening and what they need to keep doing at home. So when they're cut off from the hospital, that is a big challenge because you get lost, you get increasingly worried and stressed as to what's happening. What digital can do is enable you to bridge that because you can't avoid that happening, right? And we have to comply for safety reasons with the situation at that point. But I find digital gives a new way to complement what would be a traditional setting where you go in to see a doctor. And if you just think as simple as we're all zoomed out, right? You have something happen at home, you want to talk to a doctor, and what do? You can pick up the phone. That's a very easy way. But sometimes the doctor also needs to see and understand things. And that's when digital starts to come in. How do you share, like what Raphael talked about, data, right? Doctor's not there, right? They can't exactly do something. But that's when we start to think about how digital can complement the existing systems. And I think the pandemic was, in that sense, an opportunity for us to really start to think outside the box with all these gaps that we have in the existing way that healthcare is delivered today.
Right. Now, yeah, I mean, like, we've seen how we've had to, well, liaise with doctors via WhatsApp, and it's just not ideal, but it also just gives us a greater sense of access to them that we've never had, pre-pandemic, so.
Yeah, and to Rafael's point as well, right? Digital is digital, but there's also that person side, the human element. We have doctors that just don't want to be on digital, right? We need to also understand why. I think the tool sets are always there, but for it to work really well is to combine that technology and the digitization with how we change our behaviors.
Exactly. Now, Rochelle, very selfishly, I'm going to ask, how do you think Malaysia will fare in the digital healthcare landscape? Do you think our government and private sector stakeholders, do you think they're doing enough?
I think definitely Malaysia, when it comes to healthcare overall, is ahead of the game and a country that is recognized in the region largely by anyone who looks from the outside, right? And similarly, we can see that digital healthcare has been a strategic priority. Maybe just to add on to what Edmund was saying about the human element, it's also important not to assume that everyone is going to go the digital route, right? So we need to, perhaps in the earlier stages, maintain some flexibility, but gradually, softly push it forward, I would say. And that's where the government has a big role to play. And we have examples today, because if you look at the My Sejahtera app, so we had to use it ourselves to come in. Quite an interesting experience, but it's good because you have access to data. You're able to trace everybody. Everywhere we go, we can see that you need to scan in and check in with the QR code. So that's an example of how something was rolled out for the purpose of monitoring and ensuring that healthcare overall and the infrastructure overall continues to remain sustainable, I would say. So that's a good example. I know also that there is the Malaysian data warehouse. Again, strategic initiative, because here the angle is how do we collect data in a secure manner to analyze it and then feed into larger healthcare decisions. So these are both very good examples from Malaysia. So I think you're definitely headed in the right direction.
Good to hear that. Rafael, Malaysia is increasingly considered as a fertile ground for piloting digital solutions across the board in different industries. What are your views about this, and does it help push the digital healthcare agenda here?
The short answer is yes.
What's the long one?
Based on the research, because of course we did a little bit of research before coming in, Malaysia is one of the most advanced Asian countries as far as digitalization. Rochelle mentioned Sejahtera, we have to use it. So that made digital and even digital healthcare ubiquitous. You have to use it, you have to check in. Yesterday I was at the mall, I had to check in, I had to use it. So everyone is familiar with it, and it pushes the agenda as far as digital healthcare. I think also, Edmund, you mentioned it, with COVID, we're zoomed out, but also we want to be zoomed out. I think during the pandemic, at least, I think the numbers were around 80% of people were more comfortable, patients were more comfortable having a virtual consultation than going to the hospital. So that means that there's a will to go, and as Rochelle mentioned at the beginning, we need to push further. It's not a good idea to go back to the old ways, because we have the technology, we have the habits, and as far as Malaysia specifically, since we've been here, we've seen that appetite for digitalization and digital healthcare. So definitely it's a fertile ground, and at Axios we're very happy to partner with such enthusiastic partners to push that further and to keep transforming healthcare.
Right. Now, Edmund, you have all the experience dealing with local healthcare stakeholders. How do you think Malaysia will fare in the digital healthcare landscape, both from the point of view of healthcare providers as well as patients?
I think there's definitely a lot of opportunities, right? And the catalyst, of course, was the pandemic. Because when you think of hardware and software, there's so much out there that can be adopted and adapted to bring value, right, to how healthcare is delivered. So definitely the opportunities are there. But when we sort of think about, what would work, I think we have to prioritize because there are going to be so many things that we can do. But if you look at where the real unmet needs are, so for example, you're just not able to talk to your doctor and something's really happened at home. That's when all these technologies can sort of come in. But we have to work around the practices that we have, not only from a regulatory point of view, from healthcare providers. They will have their own sort of requirements of what they can and can't do, but as well as behavior from people, right? So both Raphael and Rochelle talked about MySejahtera. How willing are patients also willing to adopt these things? It's a good time because I think a lot has changed enough that people are a lot more open-minded, right, to adopting these things. It's now sort of getting started and keep moving forward. Like what Rochelle said, all these are choices in a way. We've got to keep complementing what's available and keep expanding it.
Now, Rochelle, I want to talk about PPP. It is widely acknowledged that the public-private partnership in Malaysia's healthcare system requires further strengthening. What can Malaysia's dual-tiered healthcare system do to improve the country's healthcare ecosystem?
When it comes to PPPs, I'm going to talk first from an Axios perspective, right? So let's talk broader about partnerships. This is something that for us, we really think this is the key to unlocking access. Because simply put, there's no need to reinvent the wheel. There is definitely a player out there in the healthcare system that has the capability to address any one component of the patient journey or complement, right? So it's important to get together and bring our best strengths to the table. And I think in our small way as Axios, we've been trying to do this in Malaysia. So we have partnered, for instance, with the National Cancer Society, where they were focused on awareness for oncological therapies. And our role was to bring in access to treatment. Today, also, I'm glad to be here with Edmund because we will be formalizing the partnership between We Care Journey and Axios, again, looking at a new therapeutic area in the space of rare diseases. And these are small examples, right? And how do we take this to the next level from a country perspective? If I recall well, when there was the rollout of the vaccine, initially it was controlled from one particular sector. And then there was the realization, actually, we can't do this alone. We need to act much faster. And that acceleration piece is critical. So we were able to tap into the private sector, tap into their resources, and then ramp up the vaccination rates. So linking back to what I said earlier, where we should not forget the learnings from COVID, we need to continue in that direction. Let's look at if there are nurse shortages or in general healthcare practitioner shortages. How do we shuffle around the capabilities and the skills that we have in the public and private to make ultimately healthcare accessible, but also improve treatment outcome for patients? Because that's really the goal for every party that's involved here.
Right. So, Raphael, let me just get the question out of the way first. Digital healthcare solutions work by storing and analyzing various types of patient data. How does Axios keep this data secure and confidential in order to protect patient privacy? And how do you reassure patients about the security and the privacy of their data? I'm asking for a friend.
We're going to get a little bit geeky here. I mean, data is the new oil, right? It's the usual saying. More and more data is collected for analyzing purposes. But also, it's our role to protect ourselves, because we have a role to play, but also others. And in our case, because we have multiple platforms for multiple types of users, including patients, which are the most exposed, I would say, as far as data. This is our role to protect them. And I usually say that I spend about 50% of my time doing that. Yeah. And this is where we get geeky, because there's a lot of standardization across the world as far as GDPR, so privacy policies. We follow GDPR strictly. We actually got a certificate very recently in the UAE, and across the globe, this is where we strive. We also have developed our entire suite of solution using ISO certified policies and procedures, which means essentially that we follow a very strict set of rules in order to protect data. And finally, we do collect data, that's a fact, but we have only one purpose. And that purpose is analyzing it, sharing it with the program sponsors as aggregated. So it's not unique, you're the patient, we send your data, it's all of the patients aggregated together in order to improve our programs. What we want to do is better patient outcomes. And how do we achieve that? It's analyzing the efficacy of the current solution and kind of pivot if we need to change, if we need to improve, continuous improvement, and that's through data. But as in Axios, we don't share that data, and we will never sell it to other parties because that's not what we want to do.
Edmund, the next one's for you. What is the role of teleconsultation or digital technology in building treatment adherence amongst patients? Now, will it be? Do you think it'll be an important tool moving forward?
So, Audrey, I think it's going to be a vital tool, right? Because if we think about what's the traditional way of consultation, which is you're going to have an appointment, you go and see your doctor, you travel there, you wait and all that. That's a traditional way. But that doesn't work for a lot of people. And where it really doesn't work is where sometimes the need is the greatest, where something has really happened and is really worrying you. So for example, I've got two kids, so both of them are on daily therapies for different rare conditions. So one of them, my older son, Jaden, has to inject himself every day. But in that process of injecting himself with something called growth hormone therapy, things can go wrong. The needle can sort of accidentally come out, some of the liquid inside comes out. Then you know what you need to do on a day. He needs a minimum amount to be injected. But do you stop? Do you redo it? Do you draw out? So it's at night. Which doctor is going to be available? That's when digital comes in. So if you work with a doctor who's willing to adopt digital technologies, right, and just say that, yeah, you can contact me, you can send me photos, send me what happened, show me pictures, even get on a quick video, let me have a look. That helps, right? Because otherwise, guess what? He would have missed it. The easiest thing for us to do then is, just stop. Because you don't know what else, right?
Just skip it.
Yeah, just skip it. Yeah, better that. But that's just, I think, an example when the whole digital space, if it's able to give, I think, reassurance to the patient that they know what they need to do next, it's a big step towards adhering towards the standards of care that we all want, right? Because like what Rochelle said, we want the best health outcomes. But at that point in time, as a parent or a caregiver or a patient, you're just like, I don't know what to do now. That's when, for example, you can step in. The solutions can sort of step in and help.
Right. Now, Rochelle, Axios International's patient support programs are known to broaden healthcare access. How do you achieve that? How do you broaden the access?
So at Axios, we believe that each patient journey is different, right? So we need to first map out holistically what could be all the different barriers to access for the overall therapeutic area, but then we really get down to an individualized approach. So to Edmund's point, right? So we need to look at a situation where what would this family risk in terms of what are the risk factors that would impact adherence to treatment? How do these map out? So based on that, what are the interventions that we need to put in place? At the same time, you may know there are many programs that are running related to affordability because that usually is the first barrier to access. And everyone's ability to pay is different. So understanding that is also important so that we don't create a burden for the patient and their family, but allow them to access treatment and stay on treatment. And in all of our interventions throughout all of our patient support programs, our thinking is the same. So using really an individualized approach, yet scalable. because, as I was alluding to earlier, time is critical. So time to intervention, making sure the intervention is actually effective, making sure that the patient fully understands what needs to be done so that they actually stay on treatment. This helps us eventually broaden access because we're able to gather insights from these patients. We're able to understand that actually it's not that you just self-inject. You need to make sure that the child understands how to do it. And you need to understand that maybe they've had a long day and they're tired, and it's not that they don't know how to do it. They're just not in the mood, for instance. Those are all, when you think about it, you say, oh, but why would you want to know that? No, we need to capture those insights, understand if that's a real trend, and then put out a solution that addresses it. So that's where, for me, we were talking about data earlier, that's where data becomes important. Pulling that information, making it systematic, developing the trends, so we are able to provide solutions that are holistic.
Sounds super cool, I have to say. Right. Raphael, the next one's for you. Do you believe Malaysia will become a fully digital country in the coming years? While people are becoming more digitally literate, many people, particularly seniors, they've been hesitant to use digital healthcare services because they prefer that whole one-on-one experience, consulting a doctor in person. So how can we address this issue?
I think you said it best at the beginning. You guys are cool.
That is true.
So I think, yes, you are in the right direction. I think you mentioned the numbers, 90% mobile penetration. I think it's above 28 million active users on social media. So there's clearly, as I said before, an appetite and activity on digital solutions. But I think also, as you mentioned, what we call digital divide is increasing amongst or between the generations. As you said, seniors are less likely to adopt because it's usually both technical and personal. Technical because they might not have a smartphone, they might not live in an area where you have 4G, but also personal on the sense of trust. Privacy concerns, we talked about collecting the data. So those are, I would say, the two main reasons. How do we address that? At Axios, we've established kind of a roadmap to that. The first one, or the first area to look at is user experience, user interfaces. Make it so that it's simple, efficient, straight to the point, clear. You have a button to press. It's huge. It's there. Talking about huge buttons, it's accessibility in the sense, as I said, technological accessibility where you have to have some sort of hybrid solution, but also accessible if, for example, people with that can see well, that have eyesight issues. So you make it bigger. You make it possible to make it bigger. The font, the colors. Some people are not reactive to some colors. So that's also has to be included in how we develop all of this. And there's again, getting a bit geeky here, there's a bias. So we need that human-centered design because there's a bias for the developer. When we create a solution, we assume it's easy to use. We assume it's clear. Obviously, they're going to go here, they're going to go there, press that button, upload. That's not true. So we need to work also with the users as a feedback loop so that we implement the changes because, as I said before, human error exists everywhere, and it exists also when we develop solutions. So those are the three areas that we focused on, and all of our solutions were implemented with that in mind. So that's how we're going to get to a fully digital society in Malaysia and in the rest of the world.
Edmund, I know I've asked you quite a few questions on teleconsultation. I promise this is the last one, maybe. Do you think teleconsultation will have an impact on the relationship between physicians and patients? And how do we overcome digital healthcare's limitations, if any?
So teleconsultation is really, face-to-face, but not face-to-face. Yeah. Yeah. So everyone, again, I mentioned about Zoom fatigue. You felt what it's like, right? So that's also real. That when you do digital, there's a lot of things you don't pick up, right? You don't pick up. That's sometimes important for consultations. So in certain cases, that's absolutely critical, but in certain cases, it's also not. So the ones where it's not is, for example, exchanging information, trying to make a quick decision. The ones that it can be is that it's a very profound issue, that there's a lot of deep conversation that needs to be had. So there's always, I think, a balance. But where teleconsultation always helps is that it should be complementary to all these things. So it will always be able, if used the right way, to add value. So when Rochelle talked about, individualizing these things, it's where, with what Rafael does with the technology, be able to customize these things so that it's fit for purpose, right, where it needs to be. Where it can also go wrong is that because digital can be very accessible, that people's behavior needs to also adapt around it. I'll give you an example. So, one of my son's doctors is very good. I can contact him anytime, he'll respond. But he'll also share with me that he's got some parents who will contact him 5 times a day. Don't like the answer, follow up with 10 questions, 20 questions, right? That can then, you can then see the negative effects of accessibility, but we still need to work around it, right? So for example, he will then move some of the parents to an intermediary layer, so nurses will sort of manage that. So it always needs to, for us to think out of the box, to blend really two things, right? The person-to-person aspect together with the digital. I think that's when it sort of makes the most value. Rather than think it's digital or not, it's actually physical plus digital working together in different ways.
Rochelle, I have another one for you on PSPs. How can digital PSPs improve the understanding of the patient journey here in Malaysia?
Maybe just a quick clarification. When we talk about digital PSPs, often, external stakeholders think, oh, so it's just an app, nobody talks to me, everything is done automatically. No, because it would be a very unsuccessful access initiative, right? The human intervention, the personal touch that Edmund was mentioning is key and is always the starting point to any patient journey within one of our PSPs. Now, where digital helps is in enabling that interaction, making sure that the interventions that we do are captured in a systematic manner, making sure that we're able to interpret what happens to a patient in Malaysia and compare that to what happens to a patient in Thailand. So that's where, for me, digital plays a critical role in our PSPs. I do foresee an uptake here in Malaysia, and it will allow us to reach more patients in a more effective and efficient manner.
Rafael, I have one last one for you. Do you believe digital technology can address healthcare needs on its own, or do you think human intervention is still required? I know Rochelle just gave us her thoughts, and
Yeah, they stole my
you
thunder,
better
right?
agree. Yeah.
The short answer again is no. As Edmund and Rochelle said, tech is a game changer. You mentioned it at the beginning, but it's quote unquote only an enabler. And behind all of our solutions and any digital health solutions, there will always be human intervention. For 2 reasons. One, when we focus on what Axios does and access adherence, we know for a fact that human interaction with the patient increases all of this. So we can't replace that human interaction. Machines are getting very advanced, but it's not Terminator. They don't empathize. They don't. Well, Terminator doesn't, but they can't understand the impact on patient lives, the impact of an illness or of a treatment, of the entire journey. And behind Axios Plus, which is the suite of our digital solutions, there is 25 years of experience at Axios. And all of that human experience is ingrained in the solution so that we multiply the touch points, but those touch points are here between human to human. You mentioned earlier, Edmund, the Zoom or like the teleconsultation is human to human with the screen. What we want is go beyond that and still keep the physical connection, because that makes a huge difference. And as I mentioned earlier, we collect the data to improve our solutions. That's our solutions as far as access, so the human interaction, but also the technological solutions. We need that feedback. We need to have humans talk to each other to understand what works, what doesn't work, and how we can improve the solutions moving forward.
And I have one final one for you, Edmund. With reference to WeCare Journey, how do you think digital healthcare technology can be used to better the lives of rare disease patients? And maybe you can share some examples with us.
Okay, I'll share sort of two examples, and these came up because of COVID, right? So, like I mentioned earlier, COVID, cut us off, those needing chronic care from the healthcare providers. So one of the things that we did, and we were looking at it from a service point of view, was physiotherapy, because for certain rare disease patients, physiotherapy is absolutely essential to maintaining their quality of life. But if you can't go to a hospital and you can't have a physiotherapist work with you, what are you going to do? So we use just what tech we have. So it's not Zoom, but we use an alternative where the physiotherapist can dial in together with the patient as well as the caregiver. And the caregiver starts to learn to be the physiotherapist, at least under guidance with the interventions which are possible to be learned. It won't be perfect. So I've done it with my son. I've overstretched him before and he went to pain, right? But if you think of the pros and cons, you have to balance it out, right? Either he gets nothing or he gets at least something. And for me, there are also other benefits. So for example, that time, that connection that I have, not only with a therapist, but with my son doing therapy, right? I think sometimes we don't count these sort of things in healthcare, but if you think of how when things work together, there are other benefits that sort of come out from it. The other example that I find, not from a service point of view, is the sharing of data. So my younger son, who's also got a chronic, rare condition. So he's in the age group of 5 to 12, and you all understand that was the last group. And there's so much hoo-ha, whether it's safe, not safe, and all that. But at the end, it was absolutely essential for them to get vaccinated. But because he's in a high-risk group, there are additional things that I need to think about. So how do you do it? So you can go in a hospital, you come out. But in these sort of situations, honestly, unfortunately, there are situations of triage. I can't just bring him back to hospital, right? Because it's high risk. He's not on the priority list that he's going to get care. So I need to step up my care at home. So what do? So things like monitoring heartbeat was quite essential. So you work with a Pete who says, yes, you can contact me. And what do? I've got a pulse oximeter. Can I measure that every time? No, I can't. So I take my fitness band, put it on him, measure it, take pictures from the phone that takes it, historical data, send it off, right? We just work out an interval that we're just sending this stuff. But you think that's really patchwork, lah, right? You're making just patching things together. But if you sort of think more, if we sort of make that solution a lot more, integrated, much more, even more reliable, that's when it's actually providing, ultimately, like what Rochelle said, better health outcomes, right? Because we can do monitoring, the doctor can sort of work with us, and it's that sort of sharing of data. But, those are two of the examples that, at least, we did. So for vaccination, we provide vaccination as well. But now at least we've found a way that, how do you do, like what Rochelle said, out of the clinic care? Because a lot of that happens, guess what? It stresses us out. Because that's when we get stressed out, and that's when we make poor decisions, and that's when adherence issues becomes a problem, and staying on treatment or doing even the right treatments. Yeah, but just two examples that were prompted because of COVID.
Thank you for sharing those with us, Edmund. All right, it is now time to take some questions from the floor.
I'm Cecilia from the local media. So I actually have a couple of questions for Axios, and one of it would be, what is Axios' international commitment to Malaysia in the healthcare field? And the other one would be, how do you see the company expanding its healthcare access initiatives for Malaysians going forward?
So, what is Axios International's commitment to Malaysian healthcare? maybe a little bit of history on Axios. So we've been around for 25 years now, with a focus on addressing access challenges across emerging markets. And we started to work in Malaysia in 2008. So we are small, but we've been here for quite some time. And our commitment is really to continue to work within the existing healthcare system with partners that complement our solutions but are like-minded to really address most, if not all, ideally, that would be my wish, challenges and barriers when it comes to access, and I mean access to diagnosis, access to treatment, but also being able to stay on treatment to achieve those better health outcomes. And for us, it's important that we're able to do this for patients, not just that are in the hospital setting, right? Wherever the patient is, we should be able to reach them.
I hope that answered both your questions. All right. Anyone else with a question? Please don't be shy. Oh, there you go.
Okay, so hi guys, my name is Iza. I'm from Murai.my, the local media as well. So my question is, what's the impact of 5G on the future of healthcare issues? Yeah.
This one is for me. That's a very good question. And the answer is quite complex. If we take a look back at when 4G was rolled out, I would say around 2008, around that, it took about 3-4 years to have a real impact. And it will be similar in our case, or in the case of 5G. Depending on how it's rolled out at a government level in each country, that's a question for the country. But the impact overall will take a little bit of time for multiple reasons. One, the idea needs to come, and this is usually triggered by the possibilities. And today we know the possibilities. I can't remember the exact figures, but we're talking a multiplication of speed that is beyond what we could imagine. And we have, I would say, inventors that are already talking about self-driving cars, which are a case, but also flying cars, who knows what they're going to come up with. So the idea is first what needs to happen. But the second, and I would say most important, is whoever creates those technologies, they need to learn. And that technology does not really exist yet. So that's going to take a little bit of time. And the third one is adoption. We were talking about trust earlier. Do we really trust a self-driving car? And that's going to take time as well. So if I had to venture a guess, I would say we're 4 to 5 years to really see the impact. Hopefully a little bit earlier, but if we were being reasonable, 5 years would be a good guess.
All right. It is already noon, so we're going to have to wrap up. But before we do wrap up, we have an important announcement to make. We would like to announce an MOU between Axios International and We Care Journey. We don't really have the details. It's been a bit hush-hush, but since we have both Rochelle and Edmund here with us, we'll get them to give us the details. Rochelle, you want to talk to us about this MOU?
Sure, thanks, Audrey. We've been hush-hush because it was such a great moment, I would say. So we've saved the best for last. For me personally, this is a great honor to be here and to be able to partner with like-minded individuals. We were talking about it earlier. So as Axios, we believe that we need to find a way to reach patients wherever they are, and in the process try and transform access to healthcare, right? So I think this MOU is truly a commitment and stands as a symbol towards that step and heading towards the right direction. Our focus is getting access to treatment for as many patients as possible. And with this MOU with We Care Journey, we will be able to support patients, particularly in the area of SMA, so rare diseases, to hopefully get more access to treatment. It is a bit of hope, I would say. It's not the final solution. Edmund and I still have a lot of work to do, but very excited to be here and to start this journey officially face to face in Malaysia. Like, we didn't even want to sign it digitally. We said, let's sign old school.
I like old school. Edmund, your thoughts about this partnership?
I think going back to what Rochelle said, partnerships are important because no one stakeholder has the whole solution, right? And when you're looking at access to life-changing drug therapies, the system that we have in Malaysia is progressive, but it's not perfect. So there's still issues with equity. When we look at the area of rare diseases, and Rochelle mentioned SMA, or spinal muscular atrophy, there are revolutionary drug therapies available today which can completely change the course of a baby's life, right? So if you compare to an untreated child, they will eventually lose their ability to move, eat, and breathe. And the majority of these babies we will lose by 2 years of age. But with new drug therapies, right, they will grow up just like you and me, right? They retain their function if you treat them early enough. But when you think about access to these therapies, things take time with the government, right? But because they take time, it doesn't mean it's okay for the children who are born to have no option. So the option that we are thinking of is at least that hope. So that hope is, from a parent's perspective, a huge deal. And I think from a patient's perspective, a huge deal. Because they are given the choice now to believe that their life is deserving. Right? If you have no access, unfortunately, you will feel that, what choice do you have? You will just succumb. But when you have an ability and a pathway towards access, and of course, it's not going to be, fit for everybody, right? We still have to work within limitations of affordability and accessibility, but it's a major thing because this is going to be the first. Right? It's going to be the first one where patients and caregivers, right, have access to something that was not available for so many years. So, like Rochelle said, there's so a lot of work to be done. I don't think it's an easy thing to do, but the important thing is the commitment for me, for Persatuan WeCare Journey, to be working with a global leader like Axios. It gives us a chance that we have a confidence that we will get something up and running that can really transform the lives of these families with rare diseases.
Excellent. Really looking forward. On that note, can I invite the both of you to officiate this MOU old school style? Put your John Hancock down on paper for us. And of course, for a photo op.